This one vitamin deficiency, wrinkling your face. I did a video on this about a year and a half or two ago. This is an update to that video because there's a lot more to vitamin K2 and D3 than just the wrinkles, but it's one angle for sure that you need to know about. In that video, I talked about a study showing bone loss and the wrinkling that's occurring of people at a younger and younger age. You don't need to tell me because in my clinic, I see it all the time. People in their 30s as opposed to their 50s who are getting skin wrinkling. And when you look at them, these are people that have a lower mass of bone. So bone loss certainly is something that we look at when we're rejuvenating the face. And today I'm going to tell you how much more there is than just the wrinkles on the face, but it's the bones for the whole body, cardiovascular protection, and so on. No question, people get a facelift, the age of 50, 60 or above. They still don't look young sometimes. And why is it? Often it's bone loss. Certainly a facelift takes care of removing skin, but that bone loss just adds that older look. So it's very important, not just for our health and well-being, that we think about calcium in our bones and away from our heart and tendons. There's so much more to K2 and many of my patients are on it. So I'll expand on that today. As far as the face goes, the knee-jerk reaction of most clinics is to freeze and fill the face with botulinum toxin and fillers and treat the skin as opposed to this underlying issue, which is the bone. Add to that the loss of estrogen levels at younger and younger ages and estrogens in our food, and this leads to premature aging. Yes, I am seeing fine lines and wrinkles at a younger and younger age. I'll try and make this video as brief as possible, but it's just so important. I'm going to answer the following. Will K2-D3 as a supplement make your skin better, and why? I'm going to use data from the studies, but also from my clinic because I try and put almost all of my patients that are appropriate on K2-D3. It makes that big of a difference. What exactly is the form you want to take? There's MK4 and there's MK7. I'll go through that. What else can K2-D3 supplementation do for you, and what is the evidence, if any, that exists? What are the benefits you can expect as a person if you supplement or take foods high in it? Number 5, can you simply get it from diet? And the single best form of food I'll reveal today. There's a couple that are way better than others. And then exactly how I take this and my patients use K2-D3. So first of all, what are vitamins D3 and K2? Let's start with the Ds. Vitamin D is also commonly known as the sunshine vitamin because your skin can produce it in response to sunlight. That's why you hear of it. Some people in certain parts of the country will take it and others don't. And we'll talk today about sunlight exposure and what that means, but that's what it's known as. Very important. Vitamin D1 is no longer used as a term in the nomenclature so much. You'll hear about D2. D2 is a true form of vitamin D. It's found in plants. Vitamin D2 is cheaper to mass produce, so you'll find vitamin D2 fortifying a lot of foods that we eat. But vitamin D3 is actually a more effective compound than D2. So that's why when you see a vitamin like D3, K2, what the heck's the D3 about? Now you know the difference of D3 and D2. Most vitamin quality supplements that are on the market today have D3 if they're of high quality. Remember, you get what you pay for, and I always tell people the most expensive product or treatment or whatever you're buying is the one that doesn't work. How many times you order something now, you get it and you never use it, or you use it, it was a little less expensive, but it's kaput. It doesn't work anymore. That's the most expensive thing you can do, especially with skin creams. You can buy cheap, inexpensive, but if it doesn't have the quality, it's a waste because you'll spend 2 or 3 months putting it on with no effect. Vitamin D3, also known as cholecalciferol. It's a fat-soluble vitamin naturally produced in your body after the pre-vitamin is made from the sun, and that's the sun component. Vitamin D3 is essential to your body's calcium absorption. This vitamin plays many functions in your body, but most important is the absorption of phosphorus and calcium. Of course, we know those from things in our bone. That's the good calcium, the stuff that gets to our bone. Vitamin D also contributes to maintaining the functioning of your immune system, and that has come to the forefront so much in the last few years, of course. I want to mention here that darker skin types need more sun to make this pre-vitamin, and of course, if you're protecting your skin, how many of you are on sunscreen? So if people are on sunscreen, that might push you over to taking vitamin D. D, of course, is in the vitamin D3K2, of course. I'll stop right here at dose because many of you are wondering what's the dose. In my K2D3, I use 5,000 international units, 125 micrograms. So there's international units of micrograms. Now on to vitamin K. Vitamin K1, when you think of vitamin K in your mind, you're thinking mostly of K1 because it's what clots the blood. It's what you give to babies when they're born so they clot. And it's what a lot of people don't want to take if they're on Coumadin or blood thinners. K1 is involved in the blood coagulation, and it's found in leafy greens. Vitamin K2, so D3K2, we're using vitamin K2 in the vitamin. It benefits bone and heart health. And it's another essential fatty vitamin, but it's a subtype of vitamin K. Now, to confuse a little further, there's vitamin K4, MK4, and MK7 form. MK7 has a longer half-life, and it has better bioavailability. All that means is your body can use it more easily. It's important to maintain your circulatory system as well, but that maintains your heart health, lowers the risk of cardiac disorders, and atherosclerosis, hardening or narrowing of the arteries, stroke, and vascular diseases. So there's so much more than bone. There's also the tendons and the heart that's involved with this type of a vitamin. Thus, we use MK7, considered the best source of vitamin K, and that's why I put 100 micrograms of K2 in my K2D3. So if you're comparing what you're using, that gives you some dosing guidelines to go on. Menaquinone 7, which is the same as MK7, that's the menaquinone of fermentative origin found in the Japanese traditional food, natto. We've talked about natto a lot. I'll talk about it a little later in this video, but it's a fermented soybean product, and as we talk about it, you'll see a lot of people don't take it or like it, but that's where MK7, that's where we get it from in the vitamin. So fermented foods and fermentation is important for some vitamins. Not a lot of people like those foods, however. That's the way it goes. It's important to supplement with vitamin K2 when supplementing with vitamin D. You see, vitamin D3 and K2 and calcium all work together to maintain strong, healthy bones. Luckily, people rarely need to supplement with calcium because it's abundant in food and available readily at the grocery store in reasonable forms. Vitamin D3 maintains the healthy levels of calcium in the blood, and it also increases the calcium absorption for the digestive tract. We now know that vitamin K2 works in concert then with the D3 to keep the calcium in the bones and out of the soft tissue. What would a soft tissue be, for instance? Like the heart. You don't want calcium in your vessels. One of the tests we do to see whether people might have and I don't want to say impending heart attack, but the health of the vessels in the body is we do a CT scan, a real quick CT scan, a cardiac scan, and we look for calcium in the heart. It kind of tells us if someone has a few risk factors of heart disease, it tells us, hey, is the high cholesterol, is the obesity and all the main 6 or 7 main risk factors for heart disease, is it causing a calcium buildup in the heart? Are those people protected in another way, such as genetics or so on? So give me, for example, I run a high cholesterol. I get a cardiac calcium scan to see whether that's actually causing trouble with my heart, or is the cholesterol good? Remember, cholesterol is good in many ways. For instance, it's needed to produce testosterone in the body. It's needed for our hormones. So if you have only one risk factor and you're lean and you exercise and so on, one of the things we look for is calcium in the heart. I can talk more on that in other videos. Also, you don't want calcium in your tendons. How many people, as they get older, have shoulder problems, knee problems? We want calcium in the bone. And that's what K2-D3 works synergistically to do. Now, food can be a crucial source of K2, and the major dietary sources of this vitamin are. So I always say we want to get things through food. Here you go. Number one, fermented foods like natto. Natto is that beloved Chinese dish made from fermented soybeans, and here's a picture of what it looks like. So many of us, including me, till I went over there, I didn't know what that was. It's slimy, it's gooey, and it has that strong pungent odor. Many describe it as, you're not going to want to hear it, but it's like dirty socks. So it is off-putting, and many people don't like to take it. But for centuries, of course, Japanese women have been admired for their flawless skin, age-defying beauty, and that they attribute that often to diet, maybe environment, but also diet. And natto is one of those things they eat on a regular basis. Interestingly, also, Japanese have a lower incidence of hip fracture, a harbinger for osteoporosis. That's what we look at. One of the things we study, and many of you women know you've had a bone density scan, they look at the hip or the wrist. On to another food before I digress. Number two is eel. Most vitamin K2 sources are animal-based. Eel offers a seafood alternative. There's 63 micrograms in a 100-gram serving of eel, meeting your recommended levels of the day. I remember my mom bringing smoked eel home when I was young, and I ate it, but once I saw what an eel looked like, there was no way. Now I like it again. Funny how that happens. Number three, cheeses. Cheeses are one of the best sources of vitamin K, along with nutrients like calcium and vitamin A, and of course protein. However, they're also high in saturated fats and calories, so many people don't like or eat or want to eat or are told to eat by their physician cheese. Beef liver is another one, 11 milligrams of K2 per 100 milligrams. 5 is butter. Now, I actually eat butter. I like butter. Maybe that's why my cholesterol is high, but I love it. Just a tablespoon, however, has 2.1 micrograms of K2, so quite a bit. That same tablespoon, however, contains about 100 calories and 11 grams of fat. So make sure to keep your serving small to avoid the potential risks of unwanted weight gain. But if you're active like me, I kind of want the calories. Number 7, egg yolks. Now, I know a lot of you throw them out for one of many reasons. You don't eat it. Eat the white of the egg, or you're afraid to eat it because of your cholesterol. Again, I think that's the problem. Personally, you can see the problem with many of these sources of K2. People either throw them out because their doctors told them to, or they find them distasteful. Thus, supplementation has become very, very popular with K2-D3. Separately, vitamin D3 and K2 both promote a healthy lifestyle, but together you can see they're even stronger. Now, what about research? New research and various articles into D3-K2 combinations show unique benefits to fighting aging from the inside out. Just like I like people on collagen powder, I'd much rather fight things from the inside out and then add what we need from the outside in secondarily, like skin creams, like injections of product, if we're talking aesthetics, which is a lot of what my day is. So together, K2-D3, what do? Number 1, bone health. Half of adults over 50 years of age have low bone mass. Bone health is a real concern as we get older, and we're all getting older, thankfully now, but we get more joint problems and back problems. I, of course, see it in the face of my patients as early as 30. Fortunately, the pairing of D3 and K2 seems to improve bone health across the board. So not just the general body, the femur, the legs, the knees, but also helps put it in the face. Remember with the face doesn't see resistance like the body does. The body sees resistance. You walk around, resistance builds bone. The face is on a bobble. It doesn't see resistance, so the bone crumbles. K2, D3 doesn't discriminate, and it seems like it adds bone to the facial area as well. A groundbreaking 2017 review compiled over 80 studies that show vitamin D3 and K2 together might be greater than the sum of their parts when it comes to bone health. This is because the vitamin D gets the calcium into the blood, then the vitamin K tells the calcium where it's most needed. Animal models reveal vitamin K can effectively prevent osteoporosis, but only when paired with D. Taking vitamin D3 and K2 together then actually promotes new bone growth. In 2019, researchers observed that vitamin D3 and K2 worked in tandem to form new osteoblasts. Osteoblasts are the cells that secrete osteocalcin, which is a biomarker for new bone growth. Does it then reverse wrinkles also? Look at the comments below my videos of D3K2 and read the remarks from those that are taking it. That's the benefit of these videos. Look at the comments, comment yourself. If it's not working, I'm just as happy to hear from you than if it is. It's an open forum, but read and you'll see what people are saying. Their joints and their skin and face seem to improve. It seems that these people indeed see these improvements. Be clear, I know of no studies that show or prove this for the face, but anecdotal evidence from sources like this seems to tell. Time will tell, and more studies are happening. Number 2, cardiovascular health. 1 in 4 deaths in the United States is due to heart disease. Lucky for us, it seems that D3 and K2, they work together to improve your cardiovascular health. The vitamin D makes sure you have the right amount of calcium in your blood vessels. Too much vitamin D, not enough vitamin K means your blood calcium levels will rise. Elevated calcium can create issues, as many of you know. They include fainting or fatigue, heart palpitations, irregular heartbeat, high blood pressure, heart attack or stroke. However, proper blood levels of vitamin K balance and vitamin D balance is beneficial. Vitamin K2 tells that calcium intake where it needs to go, and your blood calcium levels therefore normalize. Number 3, these vitamins also work in unison to reduce general inflammation. Inflammation can not only lead to the osteoporosis, but also cardiovascular diseases. Inflammation, as we talk about so often on this channel, it seems to have a role on just about everything aging. You do not want high levels of inflammation. It seems that vitamin D3 and K2 work together in a very unique way to soften your arteries and prevent the cardiovascular disease and inflammation. Number 4, fighting diabetes. 1 in 11 Americans struggles with diabetes. But there are new ways of alleviating the effects of diabetes, and I'll put in there metabolic syndrome, very common. So many people don't even know they have it. Taking D3 and K2 together reduces insulin resistance. Insulin resistance, not talked about enough, not known enough, especially with our food chain and supply chain. So many people teeter on insulin resistance, and it causes a lot of problems for the body. And when people don't know it and they're not diagnosed with it, it just simmers along for many years in an insidious fashion, and it really wreaks havoc with our health. Now, why would you need a supplement? And why is it that so many people are on K2-D3? Well, 2 in 5 Americans don't get enough vitamin D in their diets. Your kidneys should take vitamin D and turn it into calcitrol. It's more bioactive. In rare cases, the kidneys don't carry out this process effectively, which leads to low vitamin D. Since vitamin D is essential to the absorption of calcium, a deficiency can lead to bone loss, osteoporosis, fractures, and muscle weakness. Low vitamin D levels have been linked with heart disease. I already talked about what sunscreen can do, and there's climates where people don't get enough sun, and more skin cancer, melanoma is on the rise. So people are told by their doctor, stay out of the sun. It's bad. And indeed, there are bad effects, but one of the negative things about avoiding sun is the low D. So many people supplement with it. Let's talk real quick about blood levels. Often, I don't get blood levels from people. Often people don't get their blood tested for vitamin D. It can be expensive, and supplementing with D does not have a lot of side effects, so people just take it as a supplement if they believe they may be at risk of vitamin D deficiency, or they just don't believe the recommended daily dose. You see, I put 5,000 international units in mine because I'm comfortable with that dose. I think we're much lower on vitamin D than we should be as a population because of the aforementioned issues. Now, what about K2 deficiency? Not a lot of people talk about that. Interestingly, K2 deficiency is incredibly common, but doesn't cause any short-term effects like a K1 deficiency. Instead, K2 deficiency plays out in chronic diseases and symptoms. Many people don't even realize they have a K2 deficiency. In a 2007 study, it confirmed that the majority of people are deficient in K2. There are many possible reasons for this, but one obvious reason right off the bat might be the way grass animals produce this vitamin. All mammals, except for humans, have a necessary enzyme for the efficient conversion of K1 to K2. Let me repeat that. All mammals, except for humans, have that enzyme. As discussed earlier, K1 is found in greens, anything that uses chlorophyll for energy. Since humans don't possess the enzyme and our gut only converts a little bit of the vitamin K1, we therefore have to get the majority of it by way of our diet. However, grain-fed animals don't offer the proteins that are high in vitamin K2. Since they aren't eating K1-rich foods, they just don't have what it takes to convert to K2. Thus, we're not getting it in our food sources. Our food chain and supply is broken. That's what I think. It's also why I think we're getting hormone, weight, and energy deficiencies in our youth. Big problem in this country. Put simply, to get enough vitamin K, you must eat grass-fed proteins or dairy products or natto. Natto is much more difficult to find in the US. I have a very difficult time finding it anywhere. Grass-fed protein or dairy, you can find it. It's more expensive, but a lot of people don't choose it on the shelves. Now, always consult your healthcare provider before starting a new multivitamin or calcium supplement plan. But these are things I want you to consider because K2D3 is something I take, it's something I tell my patients about, and it's something I thought important enough for me to formulate myself. I want to hear your thoughts. What are you taking? Do you have questions on this? I can make more videos. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.